Welcome back, committee. I think we're just trying to organise some more IT and then we'll get going. Okay, let's get started. We're on to item 9. It does feel like we're running late, but we did squeeze one of the second sessions into the first session, didn't we? So thank you very much. We've got West Devon CVS with us. They're one of our key partners. So I think welcome Karen and Helen. Anna, sorry, should have remembered that. Before we start, I'd just like to thank you for the Wellbeing Fair which you organised in Hatherley. That was a wonderful event, connecting people together. So do you want to introduce yourselves and speak, please?
Certainly will do. Thank you. Good afternoon, everybody, and thank you for inviting us along. I'm Karen Nolan, the Chief Officer, and I've got Hannah. Do you want to introduce yourself?
Hi, I'm Hannah Child, and I am the VCSE Support Manager for West Devon CVS.
Would you like to put your microphones very close to you, because otherwise they don't work very well?
Is that better?
Yeah, okay, thank you very much.
Don't normally have a problem with people saying they can't hear me. Part of the reason I brought Hannah along this afternoon is for continuity, because as you may know, I am stepping down from the Chief Officer post at the end of March. The recruitment process within West Devon CVS is still ongoing, but I thought it was important that you were really clear that we do have a kind of plan. Nothing will kind of collapse into a little heap once I'm not there. And actually, as VCSE, Voluntary and Community Social Enterprising Support Manager, Hannah looks after that bit of the organisation which is about supporting our sector. The last time we were at Scrutiny was actually 2022, and one of the things, could we move on? One of the things that we said we would do at the last Scrutiny meeting was have a look at the strategic direction that we wanted to go in as West Devon CVS. I don't expect you to read this, but this is trustees worked really hard, and in October, by the end of 2022, they'd agreed a new strategic direction for us. Our vision is that West Devon people and communities are healthy, active, inclusive, thriving, supported and connected. It's a very broad brush vision, as they often are, but our actual aims are about supporting and championing community action so that West Devon is able to thrive. We also felt as part of this process it was important to set some internal aims. Our focus is often always on our communities, but actually organisationally we needed to make sure that our resilience was as good as it could be in what is some of the challenging situations. I do have copies of our last annual review, which has got a whole page devoted to this. If anybody'd like to see a printed out copy, they are available. Part of the strategic direction was about restructuring. We've grown since 2022. We are a much larger staff team. We've got what I would call a complementary focus of teams, which enable us to give a wraparound service. So we think of ourselves as an organisation of two complementary halves. One is focused on health and well-being, supporting individuals, but actually supporting individuals to access services in their community. So where somebody can't find a service for them, we are able to use our VCSE support team to work within that community to establish those sort of services where it is appropriate to do so, not appropriate to supplement statutory services or replace statutory services, but actually people's well-being, quite often the prevention agenda can be very well served by in particular community groups, voluntary and community sector. I should point out that some of these posts are time limited. They are all in place now. Last person slotted in just before December, just before Christmas, and with the new CEO that will be it, except for a volunteer coordinator, which we have listened to feedback that we're getting from our communities, and groups are telling us that they really miss the facility to come and talk to somebody about where volunteers could help them, or indeed individuals who want to give some of their time back to communities. Online is not enough for a goodly number of people. So we've recognised that. We used to have a volunteer coordinator role in post. Funding was lost pre-COVID. So we have just submitted a bid to the National Lottery for a 5-year project to try and put that post back in. Fingers crossed that we are successful with that. So again, I don't expect you to read that staffing thing, but it's to kind of give you an overview of how we have changed in the intervening 3 years. So some facts and figures from us. Yes, sorry. Currently, we're in contact with 545 voluntary and community organisations or projects that are based in or delivering services in West Devon. We are in those terms, we're quite a thriving community, a thriving borough. One of the things that we said is that one of our aims or activities was to extend our rural outreach. We've started doing rural outreach in the smaller villages as well as the community wellbeing fairs in Hatherley. There was one in Chagford earlier in the summer. We've visited Exbourne and Princetown, and we have plans to visit one every other month, I think, over the next year. Again, just to listen to what is happening in communities and understand what is available and how people are able to access things as locally as possible. I should say that most of these numbers are to December, between April and December. We have, as I said, run 3 wellbeing events this year. I've got a little bit of feedback from those in a minute. And we continue to facilitate our health and wellbeing alliances in Oakhampton and Tavistock, which are well attended. We've had 5 meetings this year. We've had about 82 groups and individuals attending. They can be quite vibrant in terms of the discussion that happens, but they are always interesting. Through our social prescribing and health and wellbeing projects, to date this year, we've supported just about 550 people. That is about linking them with community activities. And part of the response that I referred to earlier about being able to provide a holistic approach by linking the health and wellbeing projects to individuals with services in the community is the fact that we have established 5 new peer support groups across West Devon since April. These are around fibromyalgia, one in Oakhampton, one in Tavistock, cancer, Tavistock, diabetes, Tavistock, and we're just exploring some peer support around respiratory conditions. But they are just places where people can support each other when they're dealing with a specific condition. I mentioned we've got a large sector in West Devon that ranges from small and informal groups to larger nationals. Our aim for next year, from April 2025, will be to increase the number of wellbeing events that we run from 4 to 6. So we will continue to run our events in Oakhampton and Tavistock, but also 4 more in more rural areas. We are also running a workshop programme, which we've got funding from Awards for All for groups for the voluntary and community sector in West Devon. These are, we've run 5 to date, we've got 3 more to run, covering a variety of topics. And we also participate in Devon Connect, which is our online platform by the community for the community, which I'll come back to more about that later. Thank you. Some facts and figures from the 2 main wellbeing events. I haven't included Hatherley, I'm afraid, on this one, or Chadford. But actually, collectively, for all our wellbeing events, over 600 members of the public have engaged with them. A number of stallholders. We do collect feedback. Everybody says that they help increase their knowledge of services in the area. Our versions of In Touch, which some of you may have seen, the printed folders that we have, continue to be really popular. They are available online, but actually every time we do a wellbeing fair and we arrive with however many copies we take, they all go. So we do acknowledge that printed media is still the only thing that some people are comfortable with. We have dragged ourselves into the 21st century, and there is now a single sheet with a QR code on it, which people can take away if they so desire. Next slide, please. I mentioned Devon Connect. This is a shared page, which is specifically for South Hams and West Devon. It's a place where you can go to find listings of activities in the voluntary and community sector, volunteering opportunities, campaigns. It is a one-stop shop. Its tagline is by the community for the community. There will be a new jobs page on Devon Connect, which will go live at the end of the week, specifically for voluntary community sector organisations. So it is free for them to advertise. If you're a non-Devon organisation and you want to advertise your job, we will charge you, because there is a cost to the platform. There is a cost for us to have the South Hams and West Devon landing page. It's a direct route in for members of South Hams and West Devon. They don't have to go through the main thing. So we're looking at ways of making that platform more sustainable as we go forward. Thank you. I wanted to talk a little bit about the challenges for the voluntary and community sector as we see them. When I looked at this slide from 2022, which was just post-COVID, I realised I didn't really need to change it that much. A lot of the challenges now are still challenges now. In fact, in a number of them, well, in fact, in all of them, they've actually got worse since COVID. I think demand on group services are going up. It's harder to recruit volunteers and staff. Funding and raising funds is an issue, and costs are going up. Everybody's kind of chewing their fingernails about the increase in employers' NI, just one thing. Heating costs have gone up, just everything has gone up. So I think we're in challenging times, but I think equally, our sector continues to be very creative and responsive, and it does what it can, but it can only do what it can within sort of some constraints. There will come a breaking point, I think, within the sector, unless we can all work together to try and put back in some of the resilience. It's not all about funding. Some of it is about resources as well. Thank you. So how are we, as West Devon CVS, thanks Cathy, responding to this? This is our new leaflet. This is what we are doing. So for groups, we can help with funding and development, we can help find volunteers, and we can help groups make connections and networking. As I've mentioned, for individuals, we can link people who've got an idea for their community and help them bring that to fruition. Find volunteering opportunities, and we can support people's well-being with a volunteer coordinator post in post. Hopefully that will be easier for us to achieve. And we have moved into supporting well-being over the last couple of years. So we can facilitate group sessions for individuals, so help overcoming problems effectively, and also, as I've mentioned before, the peer support group. We have other projects which aren't mentioned here, but I think are important. So we work in partnership with Tamar Energy and South Dartmoor Energy, leading on a project called Warmer, Healthier Homes. And we are hosting the Dementia Support Worker on behalf of Tavistock Dementia Alliance to help support those living with dementia across West Devon as part of a 5-year project. And I've already mentioned the social prescribing. I just thought I'd share some feedback. We're not as good as we could be, I guess, at collecting feedback. But, you know, our workshops we have had feedback on our workshops that say people feel more confident once they've had it and understanding. Particularly, we ran a couple on funding because that's an issue for groups to help them be more confident about applying for funding. Our peer support feedback, you know, these are from individuals, and that feedback is this group has changed my life for the better, so much so that individual has stepped forward and will now take on facilitating that group as in a more formal volunteer role. And our community wellbeing, we get lots of feedback about these, but actually I quite like the one that says I didn't believe in the power of networking until I achieved these events. So I just thought, oh well, there you go then. That's it's a good thing to have. And I didn't know we were a tourist attraction, because the other one is the events like these are the reason we visit Tavistock every year. So I hope they spend some money in the shops as well. Thank you. So we have challenges as the CVS. I've mentioned the fact that we've gone through quite a period of change over the last 3 years. I think we're entering a period of stability in terms of our structure and our focus of our work. Part of the reason for bringing Hannah's role on board was to regroup in terms of our support to the sector. We are getting more demand on our services. We are desperate for trustees. The current trustees have identified, actually, that is one of the biggest risks to us organisationally. So I would put a plea out there for anybody who would like to be a trustee of the CVS. Please come and see me after. Having a larger staff team with different responsibilities brings its own management requirements, which have changed, and our quest is for long-term funding. I mentioned that some of the roles were short-term. We think all our roles are really vital to supporting communities. So we'd ideally like to move to more long-term funding. And obviously we are facing our own increasing costs in terms of employer NI, particularly employer NI costs. So what's next for us? Well, we are running a trustee campaign. We will be reviewing our 5-year plan. Obviously, the recruitment for my post is ongoing. Well, no, it's not ongoing. Hopefully, it will be concluded by the end of the month. I've mentioned funding. We want to focus our funding funding asks on core whilst maintaining our project now. So by core, I mean the support to groups and individuals. One of the ways we can be more efficient is through increased partnership working, and we will conduct our own internal value for money review. Everything we do is to make sure that West Devon communities will continue to benefit from our advice, our expertise, and our sort of support. And finally, I just want to thank our partners. I especially want to thank the Borough Council, both for the funding that you give us and for the space that you provide in this building, which enables us to come together as a fairly disparate team at least once a week. It's just a list of the other people that we have to work with, not our funders, but people that we work with. And that, I think, is it. Thank you very much.
Thank you very much. So our recommendation is to consider the presentation and take the opportunity to ask questions. So now is our opportunity. Councillor Vachon.
Thank you, Karen. Yes, it's more of an observation, actually. I belong to various groups within Oakhampton. We've noticed, obviously, as you have since COVID, that there are less and less volunteers in these groups, and they're obviously increasing in age. and it's very difficult to drag younger people into these voluntary groups. But on the other side, it's also found it very difficult to get the more professional services within those groups. I'm talking about like the accountants or the treasurer. Is always a difficult post to fill in these groups because it is a bit onerous on some of them, especially where there are charity commissions involved, where they have a set of accounts they have to produce each year, etc., etc. Are you finding this is happening as well? I mean, this is something I've noticed in the last 10 years, but is this a problem which you've noticed and could help with?
It is a problem that we've noticed, and indeed we're, organisationally, we rely on trustees as much as and volunteers to some extent, as much as any other organisation. I think we've also noticed that the profile of people that volunteer, as you say, is changing, particularly the younger demographic maybe don't want the weekly 3-hour slot every Tuesday. They're much more comfortable doing maybe remote volunteering or online volunteering of social media, those sort of things. But equally, those more traditional roles are still important. It's part of the reason that we have thought very carefully about what we want our bid for a volunteer coordinator to focus on. I think we need to work with groups to kind of discuss with them how best to reward, motivate volunteers, how to recruit, maybe even share volunteers, which has been quite a tricky thing we've tried to do in the past. I think we probably need to have another little go at that. We used to be in a position to run forums for people in organisations that would coordinate volunteers, but we had to drop those. Those are something we want to put back in so groups can learn from each other. So yes, I completely recognise the scenario you painted there. It exists everywhere, I think. I talked to my colleagues across the CVSs in Devon, and we're all hearing the same thing.
Thank you.
Councillor Guthrie.
Very much for your presentation. You're obviously a signposting organisation as well as setting up peer support groups. Do you have much interaction with Citizens Advice Bureau?
Citizens Advice are members of both our health and wellbeing alliances, and the social prescribers certainly would work and refer people to Citizens Advice if it was necessary. Do you want to say something?
Yeah, just that in the setting up of the cancer peer support group, the Citizens Advice cancer specialist came and helped with that group.
Okay, great. I just thought it would be a good dovetailed organisation. Thank you.
Councillor Cheadle. Chatting. Councillor Cheadle.
Thank you. I run a small charity in the Yelverton area and very much welcome one of your visits if you're out that way. But my question was, we get asked quite often to do things that are in a sense outside our geographic area. And people say, well, if you can't help us, who shall we, do you know of anyone else that can? Is that the sort of question I can direct it your way so you can sort of join the dots up?
Yes. And you're more than welcome at our Health and Wellbeing Alliance for the Tavistock area if it would fit in with your timetable, because that'd be good.
Councillor Caspar.
Within your presentation, you showed one of your leaflets. Is it possible that you could send us the leaflet via email and also so that we can put it out within our own individual medias and also send it out to our own parish councils to let them know the information as well?
Yes, it certainly is. I would have bought some today, but when I went to the stash, I discovered that the rural outreach in Princetown had eaten them. So we don't have any printed, but yes, we've certainly, and we will send an electronic version that you can print out.
Brilliant, thank you.
I see from our next report that we're going to be working with you to understand the scale and uptake of social prescribing activities. I don't know if you know about that.
I do know.
Yeah. What I'm interested in is where we are, our medical centre crosses into not Teambridge, what's it called? Torridge. So most of it's in Torridge, and there's just a little bit in West Devon. So how would you work across boundaries?
So our social prescribers, so we have social prescribers who are assigned to West Devon Primary Care Network and North Dartmoor Primary Care Network. And they work with patients of those practices. So obviously can I ask which area you're practicing?
Yeah, this is Hatherley, all the way up to Bude.
Right. So we don't supply the social prescribers for Hatherley. There are patients at Oakhampton Medical Centre who come from Hatherley. So unfortunately, we have just lost the funding for Oakhampton Medical Centre, so we're not providing social prescribers for them, just the other bits of the PCN. However, the social prescribers do work with the social prescribers from, it's Stratton, isn't it? Stratton, Bude, Hatherley, and will cross-pollinate, if you like. We have our remit, as West Devon CVS does, of course, cover Hatherley, so we do try to keep abreast of what is going on in Hatherley, that would be how they would do it. So they do talk to each other across the social prescribers.
It's reassuring, thank you. Are there any other questions? Councillor Leach?
Hi. From that last statement, you say you've lost funding to do social prescribing from the Oakie Medical. Where was that funding coming from?
So the funding for the social prescribers for the primary care networks comes directly from the primary care networks. So in North Dartmoor, which is obviously Oakhampton, plus other areas outside of West Devon, funnily enough, in Teambridge and Mid Devon and Torridge, there was a discussion amongst the primary care networks where Oakhampton Medical Centre felt they were better placed to provide the social prescribing in Oakhampton, whereas the other GP practices did not feel the same. So that was a primary care network decision, which we obviously have to work within. So that's what we're doing.
Okay, just coming back on that. So it's the actual medical centres will continue to do this particular task?
My understanding is that the medical centre has wrapped the social prescribing role up into an existing role in the medical centre. So I think it's a slightly different service. I think it is signposting, not working with an individual to help them re-engage with the community.
Thank you. I'd like to follow that. Just it's more a statement now, I suppose. Funding for all charities is difficult. We're all trying to get the same amount out of one pot. We're all in the same trough, what a better expression, and that trough is emptying quite fast. The volunteers, the same. Trying to find volunteers, and as Councillor Vashon, trying to find someone to take over the lead roles is sometimes impossible to find. The one thing I think, as you know, I try to attend the health and wellbeing groups when I can. Not quite sure about tomorrow yet, but when I can. But I've always found that your coordinating role of bringing these groups together is absolutely imperative to keep that going some way. Not quite sure how long term that's going to be. There's so many other changes coming our way, which means we don't know where funding will come from to go to charities in the future. Anything I would say with the health and wellbeing groups, I've said it before, quite often I fear there's quite a lot of duplication. Some groups set themselves up with a grant from the lottery or something for 3 years. They're very successful. It's something we'd like to keep going. They drop out, somebody else comes in, or somebody else does something almost the same. Do you think there's a better way of getting some of these groups to work much closer together so we stop the duplication?
Yeah, firstly, I did, on my challenges, I did have written down devolution on my, in my notes, and I thought, shall I mention it, shan't I mention it? So obviously there is a concern about that as a potential impact on more local funding, I would say. In terms of avoiding duplication of groups, that's, by their very nature, communities, if you empower communities to try and respond to things themselves, you will have pockets or groups that set up and form and just address a need. It could be very local, it could be at town level, it could be at borough level. I think the first step to minimising duplication is to raise awareness about what groups are available, are out there, but also to identify opportunities where they could work much more closely together. And that is partly what we hope to achieve through the Health and Wellbeing Alliances by taking a topic, thinking about how we could address it. I think people have to recognise where they are duplicating and feel that by working together or merging or whatever it might be, they can provide a better service to the communities. So I think it's very hard to impose that sort of thing that says you shall not duplicate, and actually you're doing that and you're doing that, work together. Arranged marriages don't always work. So I think a softly approach. I think we could do more. There are situations on the ground where you have groups that are doing the same thing in some towns that you think, well, why is that? That is really strange at a very local level. I think sometimes there are mixed messages. I think, get your services as locally as possible, but actually you can only have them from this group. So I think sometimes it's tricky, but we could certainly do more, and certainly we would like to encourage groups to do more. Where it's right to do so is what I would say. My big mission in the last however many years I've been in post has been to make sure that we don't get groups parachuting in where we've got local groups actually who are much more resilient because they're embedded within their community, and so where it's the right group, then it should be as local as possible for me.
Thank you very much. Are there any other questions? Okay, so would somebody like to propose a recommendation? Please. Councillor Casbolt, happy to second it? Councillor Leach? So can we have a show of hands, please? Thank you very much. Thank you very much for answering our questions and for the presentation and for visiting us.
Thank you very much for inviting us. Good afternoon.
Thank you.
Look forward to seeing you soon. So now we're moving on to a thematic update, which I think is community wellbeing. Is that correct?
Indeed.
Councillor Elliott, will you be introducing this?
Yes, that's right.
Yeah, and do you have any help? Are you on your own?
I might be on my own. It's fine.
Yeah, don't worry, we'll be nice to you.
It's fine. I've got my notes, so people can ask questions and I can take notes. So I didn't want to just slowly go through all the minutiae of the presentation that's in your papers. I thought it might be helpful rather to give a sort of overview and then to welcome any specific questions that people have got. So by way of sort of overview and history, I took over this portfolio back last March 2024, which Councillor Leach had been looking after before that, but it actually changed slightly, and it's changed slightly even since I took over in May. So it's Community Health and Wellbeing is the title of the portfolio. And what I love and hate about this portfolio is that it covers so much of the council's work and different teams. So, Patrick, you were asking, did I have anyone here to help me? Well, in fact, I've just spotted that Neil Hawke is here. So he's one of the key people that I work with, and we've been writing strategy together. Ian Luscombe, Head of Environmental Health, is here and does lots of work promoting and maintaining well-being and health. Jenny Hoskis is here, who also has a direct role in making sure that council tax reduction schemes work, that our household support fund is appropriately allocated. So actually there's lots of people here, and they're welcome to sit back there until the awkward questions come, and then I'll gather them in to bolster me. So it is quite a complex portfolio that covers a lot of different areas of the council's work. And the other thing that makes it complex is that it's very much about working with partners. So this is a brilliant timing in terms of just having had Karen Nolan presenting about the Council Voluntary Service in Devon, because we have to be very careful that we don't think that we're CVS, and we find appropriate ways of working with them and not duplicating effort. Exactly as Councillor Leach was saying, there is a problem of duplication. So we have to be very thoughtful about what our unique selling points are, or what our key resources and intelligence is that can add to the work that's already going on organically within the community. So the other thing to mention in a very practical way about the portfolio is it did originally include leisure services. So you'll see in the sort of detailed slides that are part of your pack that under Health and Wellbeing 1.5, it talks about leisure provision. Now, I will say thankfully that is no longer part of my portfolio. Adam Cunningham is now taking that forward. So we won't, let's not get into questions about that today, because that's not actually part of this. So then just to give you some sort of highlights, so there's some bullet points on page 48. So once again, in late September, we were instrumental in running the Junior Life Skills programme. So that reached out to over 450 children. So thank you to Ian Luscombe and his team who took the lead on that. The other thing that people will be aware of is the concern about the removal of the winter fuel payment to everybody who wasn't receiving pension credit. So this council has really tried to target people most in need, partly by promoting pension credit to residents. And we now have a part-time cost of living officer who works as part of Jenny Hoskis's team, who's been doing outreach work and trying to make sure that everyone is aware of whether they're entitled to pension credit. But also this year we've been able to give out household support fund funding specifically to people we've identified from our data systems, our pensioners who are just above the limit for pension credit. So we're trying to make sure we're targeting our resources. The third bullet point there is that we've updated the website so that the online support is much easier for residents to find. And the other thing that many people will be aware of is we've been developing a health and wellbeing strategy. So we've had 2 advisory group meetings. The first was near the beginning of October, and we had 13 members come along to that and make really useful interventions. And then we drafted a strategy, and we had a second meeting towards the end of November, and we had 8 or 9 members come along to that to help us fine-tune it. And that will now be going through the hub process and will come to council, I believe. So there's quite a complex web of work going on here. I'll come to an end in a minute so that people can ask questions. Just in terms of the real overview, thankfully, I've got no reds. There are 2 activities completed. So one of those is the online support directory, so improving the online presence. The other, and this relates to everybody around the table, is that the member funding, so funding for community resilience, which used to be £500, is now £1,000. And at the end of this year, this financial year. We'll do a bit of a review to see how that's going, but this is just a gentle nudge to people to remember that you do have that £1,000 to spend on community groups within your patch. And of course, you can put it together with other councillors' money if it doesn't seem very much. So there's a lot of scope there. And obviously, that's something that DIL helps support. So those are the two activities that are completed, the online support and the raise in members' funding that they can give to communities from 500 to 1,000. It's good to see that, and you'll see them all listed, 15 activities are on track and within budget. And then the one activity that is slightly off track, it's not, I wouldn't really say it is off track, but what we decided was that rather than simultaneously trying to create an arts and culture strategy and a community strategy, that the community strategy is like an umbrella strategy and the arts and culture comes within that. So we would do the community strategy and sort of have the framework for the building, and then the arts and culture we will develop as a sub-product after we've agreed that. And as I say, the community strategy is going through the hub process at the moment. So there's a draft if anybody who hasn't seen it would like to see it. So I think that's plenty from me as a sort of orientation, and then hopefully people can help me answer any difficult questions on specifics. Thanks so much.
Thank you. Thank you very much, Councillor Elliott. Do we have any questions? Councillor Vachon and then Councillor Guthrie, please.
Thank you, Chair. Yeah, thanks, Jay. I'm a little bit disappointed regarding the arts and culture. I think, and as usual, it gets put at the bottom of the pile every time. And I've been campaigning to get this on the agenda for many years within West Edinburgh Council, and it was great to see this had been put in at the last meeting. I feel that if it wasn't for arts and culture, we wouldn't be here. Civilization wouldn't actually exist. I mean, that's what actually civilization based on and grew from that. And I know the benefits it can give to the community, not just in saying supporting us, but also bringing the community together, helping mental health as well as all the other environmental, as well as everything else. It impinges on everything that we do as a community. And I see that you've obviously looking at a strategy, the LGA cultural strategy in a box, which I know quite well. And it's a very long-winded document. It mentions an awful lot in that, which is very good. But another document, which is the Arts Council England one, which is the checklist, which is a lot shorter, only 3 pages, and it is perfect because it does give you a list of what you need to do on that. So I would encourage you to try and bring this further up the scale if that's possible. Thank you.
Yeah, your point is very well taken. I agree the Arts Council has an excellent set of priorities. I've been looking at that. I have actually already drafted a strategy and used the Arts Council but it's a question of just bringing these things on tap. But also you'll be aware that as part of the overall community wellbeing strategy, we've thought through providing some funding that would support a photography competition, and that would be something that would really sort of reach out to different parts of the community, and is only one small element of arts and culture. But just to reassure you, it's not forgotten. I completely agree with you. It is the lifeblood of communities and really good for mental health, etc. Thank you for your point. It's important.
Paul's covered something I was going to say, so I'll let you off the hook, Jane. Thank you. Could add, as you like statistics and like to do research, I'm wondering if the community would be prepared to assess to see if their well-being had improved.
Yes, I think it's a good question about how you measure success with these things, because we wouldn't expect to see immediate results from any intervention that we made, because things like anything to do with health and well-being, as people like Councillor Calder will know, it's a long-term game improving people's health and well-being. There are quite a lot of metrics that are already collected, and so there's a thing called Thrive, where you can look at how well your community is doing. So think it would be a mistake to believe that we were going to collect a whole lot of new data and analyse it. Again, that would be a problem of duplication. It's more about looking at the indicators that we've got.
Can I just say a couple of things? So I speak to residents often who take advantage of the disabled facilities grants, and they're always very well impressed. I just wanted to say that. And then something I should have brought up in the advisory group, really, I see on Action HW 2.2, we're implementing a leisure centre access scheme for children in care and care leavers. And we do lots of things for care leavers, which I think is exactly what we should be doing. But I speak to young people and they get excluded from one school and then another school and then another school, but they're not in care. And I just wondered if there's any way that we can target them with some kind of support, because they might benefit from a leisure centre access scheme. You don't have to answer that, it's just a thought.
Yeah, so hopefully that will be minuted, because I think, yeah, these are really important points that members are making. Thank you.
Councillor West?
Just following up on that point, Chair, you said, of course, we've got a lot of groups out there, unfortunately, where children don't feel able to access education, and so they're educated at home. So I'm just wondering if, again, in terms of schemes potentially, I do know that, not necessarily through us, but other areas do sort of give reduced rates for people being taught at home and all that sort of thing. And I don't know if that is something that perhaps we could provide through the right channels.
Again, an interesting point. And as I say, leisure services are thankfully not part of my portfolio anymore, so I don't have to make difficult decisions about those sort of things. But I think it's really important that these ideas are collected.
And if I may, Chair, sorry, that was just to follow up to that question. Just purely out of interest, we love numbers, don't we? Do we know, have we got any idea in terms of the pension credit, of any numbers of figures that people have engaged with it as a result of our actions? Have we got any figures around that?
So this is exactly the sort of question I like if I've got the answer, but I don't have the answer. I'm looking at Jenny Hoskis, and I'm not sure whether you've got... The sun is here. Do you want to come?
Thank you. I did ask this question of the team earlier because I suspected that might be a question that we would be asked. I understand that nationally there is a bit of delay from DWP in actually processing these applications. So until that happens, they obviously won't hit our records. But what I'll do is I will find out and report back.
Thank you, Jenny. You just hear sort of reports about how some people are saying, oh, it's backfired on the government because there's more people doing pension credits, so they're going to actually spend more money than they say. But I would argue is, all right, it wasn't done in the best way, but actually some good may well have come out of this policy, which just seemed very ill-conceived at some point in terms of they were able to access it, and also within our own remit, how we've tried to help people as well. So there are positives. There's a silver lining to that initial thing. Thank you, Chair.
Thank you. Can I make another comment about the online support directory? So I think I'd forgotten about it, and it's slightly obscure trying to find it, I think, but I think the people who make use of it probably need to be told about it in any case, is my feeling. But I did look at the warm spaces directory section of it, and there's lots of warm spaces I know about which are not on there. And I don't know whether we should add a link on that page to the warm welcome space website, which seems to have a lot more of them. And the other one, which is more of a question, more of an advisory group thing, is housing assistance on the support directory. I clicked on there, and I've got quite a few friends who live in woods, in sheds, in caravans, and things like that. And there's nothing on there for them. I mean, are there support groups for people who can't afford to live in a normal house and don't want to engage with the council?
So there's a couple of different questions there. The first one, I think we do need to do a bit of user testing of the online support. So I think this is something that Mr. Hawke could take note of, and I'm sure would really appreciate members actually taking a look at it, because it's one thing to update something that is a resource, but it needs a bit of user testing And members are in an excellent position to do that because you will know both what the problems are that your constituents face, but also you'll know about local groups and resources and council services that perhaps aren't as evident as they should be. So perhaps we could take that as an action that we could send round a direct link to all members to make sure that people can really interrogate that. That would be really good. But then your other point about people who live off-grid, as it were, I think that's another interesting area. And yes, that's something that could be, presumably we could look at what's on the online support directory and make sure that if there are relevant things that's made available. Because the whole point, I mean, one of the platforms of the community wellbeing strategy is inclusivity. And we do live in a rural area and people have all sorts of living conditions that we need to take account of. Thank you.
Although thinking about it, they're very unlikely to go to the enforcement authority for advice on how to live, aren't they? Silly question, I think. Councillor Leach.
There's a couple of things when it comes to warm spaces, IT, websites. I've used this mantra for some years. We're very good at helping those who can. We're still not good at helping those who can't. And maybe CVS could help with, because they have a paper system that goes out to people. Maybe that sort of information should be inclusive into that. Junior life skills. I mean, it's something I've been close to my heart for many years. I have to take that off. I was very concerned this year that I missed it because it wasn't advertised to us members to say what dates they were on. I found out after it had happened. And I think it'll come out wrong. I'm one of the few councillors who always turned up to see how things were going, either Oakhampton and or Tavistock. Oakhampton, year before last, wasn't so successful because of issues with DMAC and trying to get buses and all those things that should be sorted out beforehand instead of on the day, traipsing all the way up to a primary school to set up in a little room to do this sort of work. I don't know how it worked this year, but if we could have some prior warning, it'd be really good. Children's mental health. I was quite proud of what we actually got going in a small way with the primary schools. And I'm not quite sure, reading through the reports, where we are. I seem to think it said we're in discussion to see how to take this forward. For me, the fact that we've had a break, those schools who've taken it up for the last 3 years wanted to keep that going through their cohorts. Now we've had a break. I don't know how that works for those schools. So if that could be clarified. And finally, for me, the £1,000 that we now get out, I was against it when it was £500 because we actually took that money from our partners to come to us to give out. Now it's £1,000. I'm even more concerned because I think some of our partners, existing partners, could benefit our communities far more than I can with that amount of money. Although I have given money to Read Easy, First Aid for mothers and children, war rooms, etc. To my mind, a CAB who could do far more with that money than I can. That's where it should go.
So thank you very much for those comments and questions. And I think particularly with the allowance that goes to members to give out in their communities, we really do need to do a review of this at the end of this year. But I think, Mr. Hawke, you were perhaps going to take up a couple of those questions. Thank you.
Thank you, Councillor Elliott and Councillor Leach, for your questions. So to take a few of those points, and then the JLS one I might pass over to Mr. Luscombe. But I think in terms of supporting those that can't, I think going back to CVS and some of the existing forums, I think it's fair to say that the voluntary sector probably know who those people are, and there are small community groups that are doing great work within those communities. So one of the things we really are focusing on now is getting that messaging right through those alliances, making sure that as the Borough Council, where support is available, we're taking that out to those key partners, and those key partners can then in turn take that back to their communities, because it's difficult for us. You know, there are barriers in place, and I don't like using it, but, you know, data protection regs, all those sorts of things in terms of targeting that support. So I think it's really important that we work with those communities through those partners. So that's certainly an effort we're taking, and I think that's worked quite well. I mean, just tomorrow, Mrs. Blake is going along to the Oakhampton Health and Wellbeing Alliance to talk about some of the housing support available. And again, all of those partners will be able to take that message back to the people that need that support. Youth Mental Health Foundation, yes, we are continuing to work with the Youth Mental Health Foundation, but I think it's fair to say we're also having conversations with Devon County Council, because the volume of contributions that we're making to one organisation to deliver that, and they are delivering, you know, really positive, as you say, you know, really well received assemblies, but we're at risk of commissioning mental health services, and that's not necessarily our position. So we just want to make sure that moving forwards we do that in the right way, because we are approaching that threshold of commissioning that service. And then in terms of the £1,000 allocated and taking that funding away from key partners, one of the focuses for the community development team at the moment is to work with those key partners. So they're having regular conversations with Karen and Citizens Advice to understand some of the specific challenges for each of those. The advisory group agreed that we could extend key partner funding at the current level for a further 12 months from the 1st of April this year. But we'll of course continue those discussions with those key partners with a view to allocating a longer term for financial arrangement, and we're thinking sort of 3-4 year financial arrangement from the following year, so from April 2026. Whatever changes come, but I think as a borough council, those voluntary sector organisations need that certainty from us, and I think if we can give them that certainty, and you know, if local government reorganisation affects that, we will have arrangements in place which mean there is continuity within those voluntary sector organisations while we work out where the cards land.
Thank you, Neil. Good afternoon, councillors. In terms of junior life skills, apologies if the messaging didn't reach you about the event this year. I will look into that and make sure that doesn't happen again in the future, Councillor Leach and other members who might have been affected. In terms of junior life skills itself, we've been putting on the event for a very long time, I think at least 25 years, just in my memory. What we're finding is becoming more and more challenging to deliver some of those scenarios due to the capacity of partner organisations, in part to deliver some of the scenarios which they provide to the children, and also we're finding the school's ability to fund the time what it takes out of their curriculum to bring the kids and physically moving them from one location to another has been a real challenge as well. So mindful of that, we are exploring our options to try and refresh that event to make it better, more effective, and make it more relevant and worthwhile to the children and their existing curriculum. And I think the key to that is looking towards some of the really good partnerships that we've already got and strengthening those, whether that's with the leisure centres who've been hosting the event for us or some of the other partners who are involved there. So that is an ongoing bit of work which hopefully we'll be able to report back to members in time.
Thank you very much. We should be moving on to the next agenda item soon, but I think Councillor Greenbury-Pullen has a question, and then Councillor West, if they can both be short, please.
Thank you for the presentation. I wanted to ask you about the support for local communities in the sense of families whose children are educated other than at school, or whose children are EHCP children, or children who aren't in school for any other reason. As we know, there's a huge funding deficit, or one might prefer to call it an underfund, from central government to Devon local authority, with 95 million being wiped last year with the cutting of children's services. what I want to ask fundamentally is, could we look or have a discussion within the parameters of this portfolio of perhaps developing, if there isn't something already, an opportunity for families who are in these situations to actually come together and find some form of support, maybe in the sense of a room on a monthly basis, because families are in dire crisis. There are potentially 30,000 families in Devon in this related scenario, and 9,000 with the current EHCPs, and that is looking like it's going to, EHCP numbers are going to diminish, which means that children are going to be potentially forced back into mainstream schooling under a provision called the Resource Hub, of which those children already couldn't manage that environment. And that's in the endeavour to cut funding, which is going to see a huge increase in social problems within our community. So fundamentally, is there an opportunity to look at how we can work to support our members, our community members, from some sort of injection of funding, support, some research as well?
Thank you very much. Can you just tell me what EHCP is, please?
Sure, it stands for Educational Healthcare Plan. So that's awarded, well, the local authority look at those awards basically, and they look to award a child with an EHCP or issue an Educational Healthcare Plan based on the needs of the child. So it could be special educational needs and disabilities, etc., etc. At the moment, significant numbers of those educational healthcare plans are being rejected by the local authority on the application, and 98.7% are winning on tribunal cases. So they are being issued, but the timescales are huge, which means quite often children can be out of school for 12 months, 18 months. I have personal experience of this, and I'm passionate about this particular area, which I've worked in for many years. And I do see a very, very clear need for community members, members of the community, to be supported where we can, because there isn't the support coming from Devon County Council due to the safety valve, which I recommend everyone looks up the safety valve. It's a cutting of it's a wiping of deficit if the government cuts services to children.
Okay, thank you. Councillor Elliott, do you want to respond?
Yeah, so just very briefly, because I'm aware time is short. So I think it's really helpful for members to raise these sorts of issues, and particular groups we should be thoughtful about who might be falling through the net. So thank you to Councillor Greenwood-Pullen, and an invitation to anybody to get in touch to say, can you check out whether this particular group is being taken care of. The caveat to that is, I think really we want the team who are involved with communities to then engage with our key partners like CVS to check out on the ground what's already going on, because we're not in a position as a borough council to provide individual support groups within the community. It is quite a subtle thing that we're doing. We have convening power, we have data, we have a lot, though, of statutory services that we have to provide, and we must make sure that we carry on with business or excellence as usual, and that we don't see ourselves as sort of putting sticking plasters on. So it's I'm not being negative about these things being raised, but we then must be aware that we can't go into rescue mode. We need to do the consolidation of what's already being provided on the ground and making sure that is as evident as possible.
Thank you for the reminder. Are we ready to move the recommendation? Would somebody like to propose it and second it? Councillor Leach, Councillor Vachon. So we're going to note the progress update against the community wellbeing section of the council plan. Can we have a show of hands, please? Thank you, Councillor Elliott, and thank you for your assistance. I think you're staying on, aren't you?
Yeah, I'm the next gig as well.
Do you want a little break?
No, it's fine.
Okay.
No, I'm aware that we want to get finished by 3 o'clock, if we can possibly, and I know that we've got Claire and Rebecca who are going to join me. So while they come and take their seats at the table to not waste any time. So to orient you to the next paper, so this is the South Devon and Dartmoor Community Safety Partnership. Now, members will be very used to us talking about West Devon getting together with South Hams. this is not bipartite, but tripartite. And we have Rebecca Hewitt here, who's actually from Tinbridge. So that it's the three, Tinbridge, South Hams and West Devon, who've got together for this community safety partnership. Again, there's quite a detailed paper. So I just want to highlight a couple of things, but then I'd like to pass over to Rebecca to just give a little bit of the sort of substance of what's going on the ground. And I think it's really important to say here, this is something that some members will have very specific awareness of because they've got casework which borders on crime and safety and security. But there will be other members who really have very little contact with the police or with antisocial behaviour or crime in their communities. So in a way, you know, there's some of us have got knowns, but there's also a lot of unknown unknowns, and that's where we really rely on people like Claire and Rebecca to work with us and inform us so that we can help with priority setting. So in terms of where we can go after this meeting, because there's really not going to be time in this meeting to do justice to such an important area of work. So you'll notice that paragraph 3 on page 57 of the papers talks about the Community Safety Partnership setting priorities in March and April each year. And that is a way of members coming together, but also using intelligence from the police and other sources so that we can play a role, a really important role in priority setting for the coming year. So we'll make sure that people are well aware of that. But this is a sort of very personal plea for people to engage, because unless we know about it, we can't help with the agenda setting. So the key achievements are listed in paragraph 4, starting at the bottom of page 57. And I think one of the sort of interesting things here for me that I wanted to hear more about was the pilot project, maximising the community protection warnings as a way of tackling antisocial behaviour. And we know that antisocial behaviour is a really important issue for our residents, and particularly thinking about older and vulnerable residents, it can really restrict their mobility if they're scared to go out at night, if they feel they're not safe in their own communities. So in a moment, I'd really like to turn to Rebecca to tell us a bit more about that. But also, you can see in paragraph 4.2, there's a lot of work going on in the community around trying to prevent problems and working with professionals. So gambling harm preventions, exploitation prevention, thinking about diversity and hate crime, suicide prevention. So it's not just about tackling problems like antisocial behaviour when they arise, but also doing that prevention work. And finally, highlighted is the Let's Talk programme, which is focused not on professionals, but on parents and carers, and very much chimes in with the sort of concern for young people in our communities. So those are some of the highlights. I've also underlined the need to get involved with this priority setting, but I'd really like to turn to Rebecca and also to Claire if you'd like to add anything, and then we'll open up for questions.
Thank you very much, and thanks for your time this afternoon, members. It's lovely to see some new faces and meet some new people. I appreciate that you've had a very long day, so I'm not going to go into as much detail as I'm normally unleashed to allow to go into. But what I would like to do is say that if prior to that priority setting, which is for the members of the Community Safety Partnership, you would like to get together as a group of members, Claire and I would be very happy to come and have a really detailed conversation with you around some of the data and some of those priorities. Because, as is accurately said, some of the things that spring to mind for the public around what the community safety issues are aren't necessarily what the data tells us. So issues such as preventing radicalisation and addressing modern slavery are very relevant in West Devon. And we'd like to talk to you about the reality of that and for you as a council to help us set those priorities as a partnership of what we're delivering in the next 12 months. As an appendix, you've got our local delivery plan for the year, which gives you an idea of a wider breadth of some of the initiatives. But the 3 that we've mentioned in the report are 3 that we are incredibly proud of, and also 3 that we're kind of leading the peninsula on those 3 different areas of work, and the one that I'll pick off. Community safety, when we've sat, I've sat in front of overview and scrutiny committees for about 20 years in relation to this role. And the question that was asked earlier on in today's meeting is how do you evidence that what you're doing is making a difference? We've really got that evidence when it comes to community protection warnings, which we can use through civil power, and that as officers of the council, we can issue those warnings to change behaviour. What we can change behaviour on is where there's detrimental impact. They're often used in relation to, and nationally they're used in relation to antisocial behaviour around things like harassment, intimidation, neighbour disputes. And we've proven that they've been very effective, particularly in tackling some of the long-term entrenched issues like that we've had potentially involving for a couple of years, and we've used these warning notices to prevent that. We've also used them around cases in West Devon to prevent exploitation continuing. We've used them where cannabis smells have been coming from property that have been causing issues for neighbours. So we can use them in a really broad range of ways. And ourselves and also Eastern Mid, who are also involved in this pilot, are leading the way across the force in relation to how these are utilised. And you can see from the report, from the West Devon data, we're in the high 80s in relation to delivery, high 80s, low 90s, into those people are not coming to attention again. So I can give you direct data that those are actually delivering what we're wanting to deliver, and that's really important in the reputation of a local council and the other partners in tackling those issues, and we're getting really positive feedback from partners in the community. So again, that's something I'd like to give you more detail in if you would like a further session to hear a bit more about the Community Safety Partnership. The other 2 initiatives mentioned in the report are really around raising awareness and trying to increase people's knowledge without frightening them to death around some of the risks that are in our communities, and doing that proportionately, but also doing that in a way where we can be really, really clear around how to prevent those issues becoming more of an issue and where to go to help. And that's where those other 2 sessions are. One lot designed to raise awareness and education for professionals, the others around the really essential role of families in being able to safeguard our children. So that's probably a very quick run through of those key points.
Thanks so much. Claire? Questions, I think, yeah. So we'll just open for questions now.
Okay, thank you very much. Thank you very much for the summary. Do we have any questions, please? Ms. Leach.
Start the ball rolling. Funding. Funding is hard, as we said this afternoon, for everybody. I remember, I think it was 2 years back, where the Police and Crimes Commissioners had actually commissioned a 5-year programme of works, and after 3 years canned it. Have you had similar instances since, or have they started to fund you properly?
Oh, that's quite a question. We currently don't have any funding directly through the Police Crime Commissioner. In the current financial year, there's some funding that's come through from the government under the serious violence duty, previous government on the serious violence duty, and we had to bid in for that. So if I go back several years, we used to get a direct allocation from the Police and Crime Commissioner to deliver our work under a community safety partnership. We could bid in for additional funding. That stopped 2 years ago. So we have been able to bid into some funding, and we have used UK Prosperity Fund in Teambridge, so we go anywhere we can to try and find money to deliver our objectives. There is no direct funding this year. We are not aware of any funding that we're available to bid for next year under serious violence. One of the things, this is a really interesting time for us as a community safety partnership, because with the new government, there's a lot of potential changes to legislation coming quite quickly and coming at us quite quickly around antisocial behaviour, but also around serious violence duty and other pieces of legislation that will impact on our work. One of those was just previously discussed by members. There are changes coming out to the law around homeschooling, and particularly that children that are under child protection plans will not be able to be homeschooled, so to put other safeguards in place. So it will be interesting to see if there's any new burdens funding that comes with any of that we can benefit from a community safety partnership. But other than the kind contribution from West Devon, Teignbridge and South Hams in relation to officer time, we don't have one penny's worth of budget as a community safety partnership currently. So thank you for your question.
So did you say the Police and Crime Commissioner cut your budget? And if so, what was the reason?
So the Police and Crime Commissioner decided to allocate their budget differently, and they ceased the funding that used to come directly as a direct allocation to community safety partnerships. So instead we bid in for funding. As a community safety partnership, we've been more successful at bidding into some of that funding than others because we've had some good initiatives that are good to go and ready to go. So we are the envy of some of the others because we've got a bigger slice of the pie, particularly in this year. But yeah, we do have to bid into it. It has ceased coming directly to community safety partnerships. So the Commissioner has spent her budget in a different way.
Good night. You might not want to answer this now. It's not a difficult question, but I'd like to learn more about the Gender-Based Violence and Abuse Forum. Where would I learn more about that, or do you want to tell me briefly about it?
So, bring it closer, sorry. I was attending a local Gender-Based Violence and Abuse Forum. It's now a Devon-wide Gender-Based Violence and Abuse Forum, and it focuses on all sorts of different minorities, if you like, transgender people and so on and so forth, and whether or not what things we can put in place to support or help or moving forward. So they do a variety of events across Devon, and it's just where we can go to raise any concerns that our local residents might have or needs our local residents might have. There is not an awful lot of that goes on in West Devon, that I've had raised to me to raise at the Devon Forum, but it is there for people to raise if they want to.
And if I could just add to that, the forum across Devon, so was mentioned, we are tripartite. We're 3 areas, but actually we collaborate a lot at the county level. And one of the things that forum at the county level addresses a lot of domestic abuse and sexual violence types of crime and takes a strategic approach to that. So there is also a needs assessment that helps drive, so we have a proper understanding of the data, and we're all the time looking to expand that knowledge and data to get partnership information as well as crime information. There's a similar process at the moment going on around child exploitation, which again we'll be able to share some of the key findings with members, and that will be drilled down to localities so we can properly understand what the risks and threats are for us to be able to respond to at a local level.
Are there any other questions?
Statement. Yeah, Claire and Rebecca, I'd just like to say I've got first-hand experience because I used to be a housing officer with Sanctuary Housing, and for a while I managed to end up covering White Lake Place in Newton Abbot. Yeah, so you know, and I worked very successfully. I have to say, Gary worked with the local police, and I have to say, my experience with the CSP was brilliant. And we were in a nigh-on impossible situation with White Lake Place, where it was just, you know, and a lot of support was given by Teignbridge and all the team and the police. And I just say it is a really important role, and it really does affect communities. And you mentioned about families being affected, and we had a massive difference of people living in White Lake Place, and some were really, really badly affected. But I just want to thank you, you know, from experience. Thank you.
Councillor Greenbury-Pullin.
Thank you. I just wanted to talk again briefly about this gender-based violence subject. Just to clarify, I actually initiated an NGO a British NGO called IUK, Intersex UK. I've also worked internationally with trans organisations, LGBT organisations globally and in Westminster and Holyrood. The one thing I wanted to say was, although there might not be on the surface a significant amount of need, I think underlying the surface there is a huge amount of need. I've spoken on and off with local organisations, and also I've got an insight, having worked with schools in Scotland on various projects, about the amount of gender diversity and challenges that people are facing, and also people of an older age who aren't recognised and don't come forward. And I think it's actually a huge problem. I think one of the bigger areas of the problem that we need to be mindful about is the fact that the new government has brought in legislation to make a lot of informed gender-based decisions illegal. And that's going to cause a lot of trauma statistically to young people who are already at almost, in the trans world, almost at a 50% risk of suicide. And it's now looking like that mental health decline is going to increase. And I just think we should be really mindful of the fact that quite often in rural communities, the issues are very well hidden and don't always come to the surface. But with such large schools in the area and an older population, interestingly, although you might not think it's significant, I suspect strongly that there is a very high percentage, a higher percentage, I should say, of need than is probably currently known. And that's something I'd be interested in working alongside you with. But yeah, that was all I had to say, really.
Okay, thank you. Do you want to respond to that?
Yeah, just very quickly. Absolutely accept your points. We work very closely with schools. Trans issues, gender identity issues are something that are very prevalent in our schools in relation to mental health, and we work very closely with that, and we connect through with other groups. So it is something we are aware of, and again, it's something that's touched on in our Let's Talk around how parents can support children and go to appropriate sources of information for that. So yeah, it is something that we do acknowledge and we do work on, so thank you.
Thank you very much. Are there any other questions? So just looking at our recommendations, recommendation 2 is that we support the priority setting process. Do you want to talk to us about how we can do that? Sorry, I think you already mentioned it, but you might want to say it again.
Yeah, no, that's fine. So the members of the Community Safety Partnership are invited into the priority setting session, which is half a day and is very, very intense, lots and lots of data. But what would be really helpful, if any members would like to get together to have a session with Claire and I prior to that, we can go through some of that detail, but most importantly hear from you what your issues are. We would like to give you a bit of context setting in relation to some of the things that we think are important from the data. So some of those hidden types of crime around domestic abuse and around stalking and those sorts of things, so that we can make sure that members' voices from the borough are heard at that session, which can be obviously shared through Councillor Elliott.
Can I just check with you what the timing would need to be for that? Because then we can hopefully get a briefing, an optional briefing in members' diaries. So,
even if it was the day before, that would be fine. So any time prior to the 10th of March.
Okay. So we'll try and set something up in February for members. That's an optional briefing, and it might well be hybrid to make it as inclusive as possible. Thank you.
Councillor Leach.
Yes, that's exactly what I was going to say. If it could be hybrid or just Teams, I think it's extremely important that we get a proper update and for new members to fully understand exactly the importance of what you do.
Thank you very much. Councillor Elliott, do you want to say anything before we move the recommendation?
No, that's great. I think that we've heard it all.
Yes, thank you very much for your time. Really appreciate it. Thanks for coming over. Would anybody like to propose a recommendation? There's a seconder as well. Thank you very much. Shall we show of hands? Doing great, aren't we? According to my notes, we're on to item 12, Connecting Devon and Somerset, broadband presentation. So Matt Borough, you okay to join us? Thank you very much. Thank you, Jane. So would you like to introduce yourself and your role? Thank you very much. Take your time, I don't want to rush you.
Thank you, Chair. Bear with me just 1 second. Did I gather earlier on that you were hoping to finish at 3? It feels optimistic.
It does feel optimistic, yeah.
Okay, I'll do my best. Okay. Good afternoon. Thank you for inviting me. Thank you, Chair. My name is Matt Barrow. I am the one of 2 engagement officers for Connecting Devon and Somerset. I initially told Kathy I didn't have a set of slides, and then over the weekend I kind of panicked slightly and thought maybe that would be a good idea. But I'll circulate them afterwards, and it provides an opportunity for me to edit as I go. So if I rattle through these and leave more time for questions, I'll try and cover and land on the key points, but I'll dwell less on the history of the partnership and that kind of stuff, which is now quite old and does take up some time.
Do you mind moving your microphone closer to you, please?
Is that better?
Probably, thank you.
Okay. So in short, Connecting Devon and Somerset is a partnership of local authorities, county/unitary in the case of Somerset, as well as the districts, and it also includes North Somerset and Bath and North East Somerset. So we're basically Bath across to Hartland, down to Plymouth, and back to Lyme Regis, and it covers that geography. And our role is to raise as many properties within the region to at least 30 megabits per second, which is the accepted definition of superfast. Now that probably feels like a very, very detailed kickoff, but it's a really important distinction because when it comes to connectivity, there are different things happening in parallel. There's quite a lot of overlap, and it's not just that that's where our focus lies, but we cannot spend any subsidy on a property that has over 30 meg. So it might start to explain some of our behaviours and where it is exactly that we target our activities. We've been going for about 12 years now, and we've worked in phases. So we're now currently within phase 3, I would say. It started off in a fairly sort of simple linear fashion, but as is often the case, it kind of gets broken up. We are the largest local body, as is described by government, so there are 52 across England and Wales, basically combinations of local authorities, and we deliver on the government's connectivity agenda. So we go to areas where there is deemed to have been market failure, and that basically means where industry says, we're not going to build any infrastructure there, it's too expensive. Our investors say that's above and beyond. So we operate on a gap-funded model, and we pay the difference between the commercial value of going to a property and the actual cost, if you like. Being the largest local body is obviously an opportunity and a threat. It's a strength and a weakness. Where we're the largest by geography, we're the largest by volume, but it also means we have the largest challenge. Funding was envisaged as the commercial sector will pick up about 2/3 of the challenge across the UK, and local bodies would pick up 1/3. In the southwest, by and large, that's flipped on its head. So we have found that with the funding that we had allocated to achieve that particular task, we are averaging around 2/3 of the challenge, with the commercial sector picking up 1/3. And indeed, in
former district of West Somerset, I think we're responsible for 84% of the superfast connectivity in that region, and commercial sector only 16%. Whizzing you through those phases, initially we worked with Openreach between 2014 and 2017, and we delivered something like 278,000 premises that were deemed non-commercial across the region. Since then, we have impacted, and I will come on to stats for the borough in a second. We have worked with Airband across Dartmoor and Exmoor on a specific national park project, because we could see that the national parks were actually going to go to the very end of regions that the commercial sector wouldn't want to address. That used fixed wireless. We've also completed a very hard to reach pilot project with Openreach. Only 2,000 premises, but each premise is critically important, and that was going into some very, very, very rural areas. So we did, within West Devon, we did work up around Throwley, and from Mary Tavy up onto the High Moor. Forgive me, I can't quite remember the name of the settlement. In 2020, we let 6 contracts across the region to a number of different providers. In your area, we have Airband under contract. Their contract actually started a little bit earlier. It started in 2018 and has continued, and the contract has been elongated because it was initially envisaged to be fixed wireless, and then the company came to us halfway through and said, we'd like to pivot to delivering full fibre. So even though we can only go to places to deliver super fast, the technology that we use is full fibre, it's the same as everything else. So rapidly whizzing through my own slides and starting to regret the fact that each bullet comes in on its own, I'll just quickly get to, the slides will be circulated afterwards. They do have maps to show the coverage, etc. But as far as West Devon is concerned, our data shows that you have just under 28,000 premises, 27,924, and under phase 1, working with Openreach, we delivered 10,600. The commercial sector delivered 8,400. It gives you a total of 19,000. Then on our kind of first stab at phase 2, through the combination of fixed wireless and working with Openreach, we delivered another 4,560. Planned into the contracts for fibre with Airband from 2021 onwards, you had 1,470 premises, and the commercial sector was intending to do 900, just under 1,000, which would give you another 2,500. Overall, that would have given you 26,000 fractionally over, which is 93% at superfast, which is a 60-40 split in terms of our build versus commercial sector. But many of you may be aware that in November we announced that our contracts with Airband were being scaled back, and that they had announced that they couldn't deliver the totality. So this is probably where the rub is, and I would envisage questions coming at this point, because it's the important stuff going forward. Overall, across the region, we have lost 28,322 premises, and that there is an impact for West Devon, but it is significantly less than in other areas of the region, and that's really because the build has been going on. So for West Devon, each of these networks is comprised of sub-networks, sub-clusters. So West Devon, there were envisaged to be 11. 7 of them will be continuing. So Airband is not stopping, they are just scaling back. 4 of them will not be continuing. However, it's worth bearing in mind that of those 4, each one has already been started, and some of them are quite far advanced. So the cluster that covers Tavistock going out towards Gulworthy, Morwell Quay, etc., 747 premises have been built, about 140 won't be. So overall, the impact is actually 222 premises, which out of 28,000, I mean, those are 222 premises, which are critically important, but the impact is actually being felt far wider in other parts of the CDS region. So that gives us just over 2,000 premises. If all of this now comes to pass, there'll be 2,000 premises within West Devon that won't be at Superfast. Because of the amount of time we've been doing this, we now receive more queries and complaints from people saying, I've only got 55 meg, or I've only got 75 meg, when are you going to deliver fibre? And at the same time, we're dealing with queries and questions from people saying, I've only got half a meg, when are you going to be delivering some kind of connectivity? The latter is our constituent. The former is somebody that we will attempt to answer the question and signpost them, but that's not what we use our money for. But it speaks to the idea of a digital divide is absolutely true, and it is growing exponentially. So whilst providers are now trying to deliver gigabit capable networks, 1,000 meg per second as opposed to 30 meg, many of them are actually now delivering 5 gig capable networks or 10 gig capable networks, and there is actually one network provider who's delivering 40 gig capable networks. So you are now starting to see a digital divide that you almost can't see from one side to the other. So we remain focused on those properties that do not have access to adequate superfast connectivity. In parallel, the government initiative that replaces the superfast program that we run is a thing called Project Gigabit, and that is about bringing the majority of the UK population, 100% envisaged target, aspirational by 2030. That's delivered centrally by Building Digital UK, not us. We are involved in certain elements, but the contracts are held by BD UK, program management, and all of that stuff is going on through them. So this is where we get a lot of overlapping projects, overlapping activity, all of which potentially have the impact. So there is a Project Gigabit contract, which is actually targeting West Devon, or includes West Devon. It's a national contract that looks at different parts of the UK. So there are 3 different types of Project Gigabit contract, and really it's a question of scale. Type A is local, Type B is regional, and Type C is national. So this is the Type C contract, which has been won by Openreach, has a target of 500,000 premises, and has a contract value of £800 million contract threshold. Within the part of that, so there are different call-offs within that contract. The one that you're in is called Call-Off 2, and it has 27,000 premises in it, covering West Devon, Torridge, North Devon, and Exmoor. But of those 27,000 premises, only 3,000 of them are sub-superfast. And if you then split that between the 4 different local authorities, you'll see that it's delivering sort of 500 or 600. So there is still a piece of work to be done to ensure that we go to the very hardest to reach premises, the ones on the poorest speeds, and we don't get distracted and swept up in the rush to full fibre. Sorry, Joe. I'm really happy to cover off an awful lot of other stuff, but I think in the interests of time and courtesy to you, if I belt up and then you tell me where you want me to go in terms of answers, and I can circulate slides and maps later.
Thank you very much. Councillor Leach.
I'll start off on a negative. I'm sorry.
It's fine.
I was here in 2014 when the first contracts were let in this big national thing saying everyone's going to have fast broadband within X amount of years. I think I'm right in saying we're on the third contract, which either has failed because Openreach, BT, or the others have done all the bits that were profitable and then pulled out because there was bits that weren't. And it strikes me we're back where we started. So we're left with the non-profitable bits, which we now led to another contract at millions of pounds against the taxpayers' money. Why wasn't it actually picked up? Why weren't those contracts properly fulfilled in the first place?
So thank you for your question. There are a number of existential points within that are really important. I agree with much of it, although not all, and I'll try and explain why. So the numbers issue can end up being a distraction. It's an important metric to judge success by, but actually CDS has always argued that all of these contracts should be outside in. You start with the very hardest to reach and you work backwards to avoid either the appearance of or the reality of doing the easier ones and then just stopping before you get to the areas of real need. That's not overall a strategy that has ever been fully adopted, and continues to be one that we push for, and one that is even more important now than it was then. So I would absolutely agree with you on that basis. Just to clarify on the taxpayer money side of things, all of our contracts are payment on results, retrospective, based on hitting milestones. So the one thing that we do have in an environment of contracts where our suppliers have either walked away or been very clear that they cannot complete the totality is that we've only paid for what we've got. We have not handed a big bag of money over to a supplier and then realised that they only did a quarter of what we wanted them to, and we're left holding the baby financially. The Project Gigabit contract that we have within the region, the Type C, I think we have a difference of opinion in the best way of going about delivering within our region, and we have always said, it's a matter of public record in terms of our feedback to the consultation originally on how Project Gigabit should be run, is that we had a concern about large contracts because we've been doing this for 10 years, and frankly, we know something about contract failure. Look it up. They're very, very difficult to manage, and the large ones particularly become utterly unwieldy. So our argument and what we were advocating for was the smaller Type A contracts. In the end, it was deemed that there hadn't been sufficient credible interest from industry to warrant running the small procurements. So they moved to the large procurements. The net effect of that is if you are running an £800 million procurement, there are thresholds. And essentially, there were 3, probably at most, maybe only 2 fibre providers in the UK who met the initial entry threshold. So all of the providers that you may or may not know operating within the region were not in a position even to bid for that. It is a very difficult thing to manage the open market review process, the procurement process, and as you go through that process, time is ticking and costs are rising. So at the point that you actually get to letting a contract on what would have been a viable commercial value when you started the process, you're into elements where arguably you need to start again. So it's unwieldy and deeply unsatisfactory, but it's what we have, and given the various different laws and regulations that govern public procurement in the UK, it's the only way to do things. So we continue to push for smaller procurements, and even with the contracts, the Type C contracts that have been let within the South West region, there's still a lot of work to be done. There are still premises that remain uncovered. The premises that fall out of the airband contracts are not currently in the Type C contracts that have been let. So we need to decide, and obviously are working at pace to come to decisions as to what we do with them. And I'm sure that probably only touched part of your question. I'm just conscious of time.
That's fine, thank you. Okay. I will just add, when it comes to national contracts, I was forced down that route because of economies of scale. You find once you go national, it goes out the window because you're only dealing with the very, very big contractors. And they're so expensive. Economies of scale just go out the window.
Councillor Vashon.
Thank you, Chair. Yeah, it's all right. I think it's a bit late in the day for me, but my mind can't get round all this. There's a lot of information coming from you, which I can't actually process at the moment. I think my computer brain is dying a bit. If there's any schematics or slides on this that you've got to show how it all works, that'd be really good, because I think probably a visual sort of schematic would help me understand this better. It sounds very optimistic and pessimistic at the same time, if you see what I mean. Optimistic that something's being done and we're going into bigger contracts, but also the pessimistic side of some people aren't going to get this. On a technical question, you say the download speed is 30 megabytes a second on average at the moment?
That is the, if a property already has that or higher, we can't pay to upgrade the speed if they are below that.
Below that, okay.
Yes.
And again, a technical thing, that's download speed, but what about upload speed?
So
I've come across that before, and some contracts you get for both equal, but the upload speed seems to be an awful lot lower than the download speed.
Yes, so full fibre tends to, or has the capability to be symmetric, so the upload speed can be the same as. However, it depends on the package that you take out. Traditionally, the copper speeds that we were talking about, particularly the fibre copper combination, fibre to the cabinet, you would, as a very average metric, you would look at 20% of the download speed being the up. So if you got 10 meg, you would be getting 2 to 2.5 upload, and it kind of factors that way. So 100 meg, you'd probably have 25 meg upload.
Brilliant. Thank you very much.
Okay. Thank you very much. I think the hub members have got a meeting to go to, so can I take their questions first? I have Mott and then Cheadle. Is that all right? Councillor Mott and then Councillor Cheadle.
Thank you. My apologies, I missed the first bit of your presentation, so I'm sorry if you've already covered this. I must say that I dream of having over 30 and being able to get over 1 for my upload speed. It seems to be, yet again, this has been going on now for over 10 years, yet again we're having another presentation promising a lot of things, and we are still finding that the most properties that are in need of this, particularly businesses in the rural areas, are still not having their needs met. And we are getting absolutely nowhere with that. We're not getting any answers to that either. I mean, if you go down past me, for example, you can see a row of telegraph poles that have been put in with nothing on them because Airband pulled the plug on it. Now, whether they're coming back to do something with that or not, nobody seems to be able to answer that question for me. We've now got Openreach in the area promising great things as well, but not delivering on that. And it just seems to be going round and round like the inevitable hamster wheel that I get while I'm trying to upload and download stuff for my business. And it's just not happening. And yet again, we are being fobbed off.
Okay, well, I don't think anything that I've said intends to fob you off. I completely get the frustration, and that's why increasingly I don't like to dwell on the figures in terms of what we have achieved, because the reality is, as we have been aware for ages, is once people get connected and they have a usable speed, the issue disappears for them, and it's not something they ever think about. So in the same way as we don't get up in the morning, make our tea, and then phone Wessex Water and say, I'd just like to say what a cracking job you guys do, thanks so very much. So all of the focus around what CDS does is around where we don't actually get to a property rather than where we do. In no way, shape or form looking for sympathy, because I know I wouldn't get it and I wouldn't deserve it. But the issue is we continue to advocate for exactly what you're advocating for, that you start with properties in the middle of the moor who don't even have a speed that can be measured, and you work back from that in terms of where you apply the subsidy. In terms of how you build the network, it actually tends to work in the opposite direction, and it's finding a way of resolving that. The previous government, this is not a party political point, it's just a point about how time evaporates, consulted on the very hard to reach premise strategy 2.5 years ago. We commented fairly fulsomely on that because it's of particular importance to us and our region, and we still don't have a very hard to reach premise strategy or indeed a response to the consultation, although the new government have promised that they will re-engage and reinvigorate. Fundamentally, there is an approach that applies subsidy on a fairly equitable basis across the country, in the sense that some places are urban, some places are semi-urban, some places are rural fringe, some places are rural, and therefore you get the same amount of money elsewhere. When you build fibre networks, the cost of the property to deliver to a property is a relatively straightforward metric based on, if you build a kilometre of fibre, how many houses will you reach? So if there's one property at the end of that line, it will cost you about £20,000 on a good day. If there are 4, each of those properties will cost 5. So in an environment where premise density across England, there are 300 tier 2 local authorities. In the bottom 5%, 6 of the 15 local authorities are in CDS land, and you are the least premise dense local authority in England. Not only that, but between the 95th centile and the 100th centile, the population density or the premise density actually halves. So on that metric, the cost of building on a very straightforward back of a fag packet basis between Teignmouth and here would double, and you're already, so the English average I think is, I want to say 800 properties per square kilometre, and you've got 27. So it is actually of the order of magnitude that much more expensive to build in this region. And when you look at a provider like Airband or others in the past walking away from the contract, ultimately the finances are at the bottom line of that they would be driving their company off the proverbial cliff to continue with the contract, and their investors won't let them do that. So this is a problem that we continue to try and solve, and it's your property and businesses like yours that are absolutely our priority insofar as we can affect both policy and delivery.
Thank you. Councillor Cheadle?
Thank you. I have an interest to declare. I've known Matt Barrow for 10 years because I think you came to our parish council in 2015. Indeed. Whereupon I signed up for a community broadband scheme. Yes. 10 years on, we're still waiting. The The problem I've got is on behalf of the residents who thought they were going to be connected by the CDS airband contract. Now that's been renegotiated, they are in that chunk that is no longer going to be connected by that contract. Airband haven't told them that they're not going to be connected. CDS haven't told them that they're not going to be connected. Some of them think they still are going to be connected, although they're not going to be connected. And although there are options on the table for national contracts, regional contracts, and local contracts, if you are sat in your living room wondering how you're going to get broadband, this is all mumbo jumbo to you. You have no input into the contracting for broadband services. You just want someone to tell you what you need to do and when it's likely to happen. And at the moment, there's a complete vacuum down at the level of the resident, completely unable to understand what's going on. And no one's telling him. I mean, I try my best to tell my residents what's going on by badgering you every 5 minutes, and I sort of feed them the best information I can. But for those not on my radar, they must just be in despair, wondering what on earth's going to happen. So we're missing a trick here somewhere. If there are plans, we need to understand and tell people what those plans are so that they have some idea whether they're going to be connected or not, and whether they have any involvement in that process, whether they can choose options, whether there are options that they can choose, or whether they just sit there waiting for something to happen, hoping that it does. It's unlike any other service I think I've come across. I mean, if the electricity fails, I know who to ring up. If the gas fails, I know who to ring up. I don't know who to ring up when the broadband doesn't appear.
So can we provide residents with that information? Can you give it to us?
So we work closely with the districts, and indeed Steve sits on the CDS board. So from senior level within the local authority, we attempt to keep local authorities informed. We work with parishes. So I think I have now done fractionally over 1,100 parish council meetings in the 9.5 years that I've been involved. So we do a couple a week. It's just the scale of the region is challenging. And the queries that you will get in, I think you can triage them. I think what you will find is some people with very specific questions about their property, and I would suggest you just refer them to us, because there are so many different permutations, to be honest. If, to Councillor Cheadle's point, you have a community that wants to take the law into their own hands and actually affect change for themselves, the third pillar of this particular nuclear arsenal is the government's voucher scheme, and that provides for a mechanism and funding for communities to come together and pull together an area whereby they say we want to deliver to these 45 premises in this hamlet, or we want to do 200, or we want to do 10. The only number that you can't do is 1, because that's not a community scheme. You need 2, and then you're a community scheme. That gives you up to £4,500 per property, which in many areas is enough to build a fibre network if you pull that together. To do that, though, you need to engage with a supplier. You need to get yourself onto their radar on the priority, because at the moment it is a seller's game. So if you want to get a fibre network built, you have to find somebody who will build you a fibre network. So we are here to support you. We've supported a number of communities over the years who have been through the process, and we're really happy to do it, and we're going to be doing more of it going forward, I suspect.
Thank you, Chair. Can you explain why, if these contracts are all sort of planned, why in one of the parishes which I'm in my ward, they have had BT Openreach fibre through the village, and then along comes Airband trying to do exactly the same. And then they get so far and stop. As Councillor Mott said just now, poles up, absolutely nothing on them. And there's a small hamlet that I'm aware of, just a few hundred yards from a fibre cable running down the main road, and they can't get connected.
So yes, I can, or I can give you an idea of why that might be happening. And again, multiple different permutations. So first off, before a contract is let, we conduct an open market review and we say to everybody in the industry, where are you building your fibre network over the next couple of years? Because if you're building there, we're not going to use subsidy. Taxpayers not paying for it. So you have a set of properties and you net half of them off because they're being built commercially. So you say, right, contract holder A, you can go to this half, these properties here. There is nothing within the open market review process that then stops a commercial provider saying, actually, do you know what, we are going to go over there. So they can come and build in an area where we have let a contract for subsidy. The open market review process only flows one way. If we accept that a property is going to be built commercially, we cannot use subsidy. But if a commercial provider says, no, we're not going there, definitely not, never, they can change their mind the following day, and there's nothing we can do about it other than be agile. So for the last 2 years, we have de-scoped a significant number of properties from our contracts because when Airband got to the point, or others, got to the point of surveying that community, they said, actually, do you know what, somebody else is already here? So we would then go through a process and actually not build. But you can have a situation where the build is actually going on concurrently rather than it happen. If it happens 6 months beforehand, we can see it, it's there, we can touch it, we can taste it, we can say to the provider, don't build the network. But sometimes it's happening at the same time, in the same week. There is something of a Klondike gold rush going, well, there was, not anymore, but there was, where you had different providers hurtling up and down rural streets. And part of it, to be entirely honest, is there is an element of spoiler activity amongst all of this. So provider A gets wind that provider B is building in area C and decides to go in and lay a bit of fibre, just to confuse things or to queer the pitch, if you like.
Yeah, so they've got fibre down the main road. I think it's just about 500 yards. There's a small hamlet. Quite a few houses, quite a few properties there. They can't get connected. Nobody will actually connect them to the fibre.
Right, so there are then other things. When we talk about de-scoping because somebody's gone in and built a community, we will tell a provider, don't go there, don't build there. But oftentimes, let's say it's the hamlet at the centre of a parish, and one of our providers has got a contract to also deliver to the rural hinterland to the south of the hamlet and to the north of the hamlet. Well, they will actually need to lay fibre through the centre of the hamlet to get from A to B. And often we have people who will say, we told you not to build in the hamlet and you still came through. Well, it's fibre, so it has to go from A to B. So that's one reason you might see that. I think what you're talking about, though, is when you can actually see a fibre network, it's only metres away, and you think, well, surely just complete it, and then 40 properties could actually have a service. You need to bear in mind that fibre networks are not necessarily built contiguously. You don't necessarily start with A and then go to B and then go to C and then go to D, because there are so many different elements in that chain that there may be a situation where you think, actually, we're going to build Y to Z first, because actually there are poles already there, we can go in and build, it's all fine. But there may be so many gaps in the network going backwards towards the actual connection, the backhaul, the connection to the internet, that what looks like an eminently usable stretch of network just outside your village may actually be completely stranded. So you can never just look at a piece of infrastructure and think, well, that's capable of delivering a service, and unless you know the trail all the way back, cradle to grave. But I get how frustrating it is.
I think we probably finished it. I forgot you, Councillor Caspar, didn't I? Yeah. So, do you want to make this the final question?
Yeah, well, yeah, I just wanted to tag on with what Terry was just saying. So if I've understood it right, it's highly possible that you could have a mile stretch of road going past a hamlet, and that stretch of road has fibre optic cable put in, but isn't actually connected at either end, just because the cable company's decided that's what they want to do, whether that be to upset another company or whether in their head they're thinking later on we're going to do it. But if it could be proven, for example, in this particular area, that fibre optic cable is actually going from point A to point B and is being utilised, how do we then speak to yourselves to say, well, when it gets in line with this hamlet, we want them to put another junction box or cabinet in to filter off to this hamlet?
So hitherto, it hasn't quite, excuse me, it hasn't quite worked that way. However, for reasons which I'm really happy to explore, but we're now at 20 to 4. Going forward, there is going to be more of that. So there is the opportunity to continue to build on from the network that has already been built in this area. Some of it is going to be happening as a matter of course. Airband will be completing some clusters, not completing others. Where there is infrastructure that's been laid that is usable, i.e. there's a cabinet, it's got power and it's got light, and has then got fibre going some of the way out, we are looking at a variety of different ways. The legal elements of it are as important as the technical elements, but it is possible to repurpose that infrastructure, get it to go further, and in some cases, get it to go where it should have gone in the first place. But we don't want to raise too many expectations, but we do need people to talk to us. So if you have an example of that, just email me. My details will be in the slides, and Kathy's kindly agreed to circulate those.
Okay, can you do a short
comment? I promised the Chair a quick question, so here it comes. What should West Devon Borough Council do in order to help deliver broadband to those that don't have a reliable, fast broadband connection? What's CDS's advice to us?
So I think probably the most important thing will be we are support for smaller procurements. So you have this Type C contract that technically covers the whole of your geography, but it doesn't cover all of your properties. There are likely two different options as to the properties that are either falling out of the contracts with Airband or haven't been built to yet. And the most likely one, because it's the most convenient administratively for government, is to put them into the Type C. But they will go in at the end, and the Type C contract has currently a delivery span of 5 years. So the properties in the region that are not currently covered by a contract or going to get connected will be at the back of the queue. And we think that it can be done better. So we think using smaller scale contracts, Type A contracts, and vouchers will allow that to happen more quickly. And I think the district.
Should we identify those communities to you, or do you know where they are already?
No, we know where they are.
We do need to finish. Yeah, so I think we should. Otherwise, we're never going to get home.
I just want to make a quick comment, very quick. I'm aware in my own area where I live, cabinet within mile and a quarter, 2 people gone to Skylink because they can't get a decent service from copper or anything else. It's ridiculous what's happening out in the countryside.
Thank you very much. I'm not quite sure it's a good place to finish, but thank you very much for your time, Matt. Really appreciate you answering the questions.
Thank you for asking me. Always happy to come back, try and provide answers.
Thank you very much.
And I'm really not even close to being quick.
No, I thought we were going to finish that in 2 minutes.
I blame you more than I blame myself.
Thank you. I think we only have 2 more agenda items, but thank you very much. So can we move on to task and finish group updates? South West Water Councillor West is no longer here, but we will be meeting during March and April. Councillor Vachon, do you want to say anything about the leisure task and finish group?
There's not an awful lot been coming back to us as members about the leisure situation, either from our own council or from the leisure facilities themselves. So I'm at a loss as to where to go next. So perhaps we just need to talk with Mr. Molyneux and see if we can arrange something to get more information going forward. Thank you, Chair.
Thank you very much. Do you know about the relationship between the task and finish group of ONS and the leisure group? Do you want to talk about that or not?
I think it's quite, Chair, with your permission. Just quickly, there are 2 parts to the fusion, the leisure contract. One is service delivery. So, are the changing rooms clean? Always a winner, that sort of thing. And then the separate one is specific, which is just what's the financial strategy around ensuring we can have a good value, ongoing contract. And there's rightfully a split. So the task and finish group from ONS, I think, should be focusing on, and have over the years, focused on the service delivery and the quality and local issues and supporting local outcomes. And then there is a separate task and finish group, as you all know, which Councillor Adam Bridgewater is leading, which is about the financial sustainability. So that's the gap.
Yeah. So there's still a role for the ONS.
There is. Yeah, absolutely.
Okay. Thank you.
Thank you.
And also, Mr. Molyneux suggested it might be time to formally close the South West Water Task and Finish group. Now we have the working group. I don't know what the difference is between those 2 things. So we've got a working group now and not a task and finish group because we're not finishing.
So say one doesn't finish.
Councillor Vachon?
Sorry, are we talking about the active travel one?
South West Water.
Right, okay, because active travel was on the agenda, on your minutes of the last meeting, but nothing's happened since.
No,
so is that still valid?
South West Water, we're just going to call it a working group instead of a task and finish group. The active travel one, nothing's happened with that. Are you wanting to be part of that group?
No, thank you, Chair.
So I don't think we need to talk about the active travel group now, do we? So is that finish? I think it's all the task and finish group updates done. So item 15 is the annual work programme. So we can be quick about this if we like, but we're talking about inviting the Environment Agency to February's meeting. We're happy with that? And are there any other comments you want to make about the work programme? I didn't think so. I've been impressed by your endurance. We've lost nearly everybody. But some of us are still here. Sorry? Yeah. So thank you very much for your time and effort. And I think I can close the meeting.